Hi guys, nice to meet you. My name is Preston. I'll be your nurse practitioner. Mr. Kumar. Okay, I'll call you AJ. All right, Ramya, nice to meet you as well. Thanks for coming in. Having family here can be really helpful, so thank you. Yes, I have been watching football. I agree. If I was a betting man, I wouldn't have put any money on the 49ers. All right. Well, before we get started, is there anything that I should be aware of or anything that I can do to make your visit more comfortable? Okay, sounds good. So I know, Ramya, that you have some concerns, but we'll let AJ start us off, and then AJ, if it's okay with you, we'll let Ramya chime in as well. Okay, so tell me what brings you in. Okay, you had a fall. Is that what the bruising is from on your forehead? Got it. Some trouble remembering things lately, okay? Trouble sleeping. Going to the bathroom a lot at night, okay? And then Ramya, you mentioned prior to the visit he hasn't been eating as much lately. Okay. Okay, let's take it from the top, AJ. Let's start with the fall. What can you tell me about the fall in the bathroom? Okay, it happened at night. You were dizzy. Okay. Are you normally unsteady when you walk? Not really. Got it. Do you use a cane or a walker? No? Yeah, it might be helpful to get you some kind of assistive walking device or at least have something in the bathroom to prevent another fall and, hopefully keep you out of the hospital. This one doesn't seem like it was too bad, thankfully. And do you take any blood pressure medications? Okay. Yeah, even if you take them exactly as prescribed, they can still make you dizzy if you go from a sitting to a standing position really quickly. So we'll review everything later and see if we need to make any adjustments and go from there. Okay, and have you had any falls in the last 6 months to a year? Nothing? Okay. All right, tell me about your sleep. What's going on there? Trouble sleeping at night, and how long has that been going on for? Okay, about a month, and Ramya tells me that you lost your wife about a month ago. Is that correct? Okay, so sorry to hear about that. Do you think that maybe that is contributing at all to the sleep issues? That and going to the bathroom. Okay, got it. Do you think that there's anything else that's keeping you up at night? And have you had any issues falling asleep before? No? Okay. Okay. And let's move on to your urinary symptoms. So you've been waking up more often at night to go to the bathroom, is that right? And how many times a night would you say you get up to go to the bathroom? 2 to 3, okay. Is this happening every night? It is? All right, is there any pain when you're going to the bathroom at all? No? Do you feel like you can get everything out when you're going? Not really? Okay. Yeah, we'll look further into that for sure. Okay, tell me about the stuff going on with your memory. So you're just, are you having trouble remembering things? Is that what's going on? All right, and how long has that been going on for? About 6 months? 6 months to a year? Okay. Does that happen every day? Most days? Are you like misplacing things as well? You are? And do you ever forget where you are or like what you're doing? Rarely? Okay. And then as far as the nutrition goes, Ramya mentioned that you're not eating as much as that. Is that right? Understandable. Yeah, you have a lot of stuff going on, new life changes, the loss of your wife. I can totally understand that these are things that are overwhelming, and grief can cause us to want to shut down. but it is very important if we can find a way to up your nutrition, because that's going to help you recover from your fall. That can help you. That can help prevent a fall in the future, and that may even improve your sleep, because sometimes our cortisol levels will spike if we're not getting adequate nutrition. Okay, well, thank you both for sharing your time with me and giving me all of this information. I know that there's several changes happening in your life right now that are difficult. We'll take it step by step, focus on keeping you safe, and do what we can to make you feel better. Thanks.